Hi, my name's Kelly. I'm a CBT therapist and forensic psychologist, and today I wanted to talk a little bit about schema therapy or schema-informed therapy. So schema therapy was invented by Jeffrey Young, and I'd highly recommend reading around the subject. It is super interesting. And with schemas, there are a range of different ways that you can use schema therapy. So you could work with the schemas, you can work with the modes, or you can work with both. So I'm just going to give a little introduction around the schemas and the different modes. I would love to delve in super deep to all of it, but I simply wouldn't have enough time. So to start off with, is that when we look into ourselves, we all go through things when we are younger, and we all have different schemas. We all have maladaptive schemas, but with Young, he developed this questionnaire, so the Young Schema Questionnaire, which asks you a range of questions. In the long one, it's over 200 questions that really explores how you act, how you interact with other people, how you manage yourself in different situations. And then at the end of it, you can see which schemas are strongest in you. And for some people, they may just have a few schemas, not really too high, and other people, they may have quite some really strong ones. So to give you an example of some of the maladaptive schemas that you may experience, so there's mistrust and abuse. Often this is when someone has been through something quite difficult when they are growing up, and they find it difficult to trust others, and that can then later translate into future relationships with other people. Or you could have self-sacrifice. So as a child, you may have not had your needs met, or you may have had to give in to meet other people's needs other than your own. And that can continue throughout your life. So that's only 2 of them, there's 18 of them. I wish I could go through all of them, but just to give you a bit of an insight. But once someone knows what schemas are strongest in them, then you can look, okay, what are the maladaptive coping modes? So within this, when a schema is triggered, whether that is triggered in a situation or with a person, arguably there are 3 different ways that we can manage with that. So the first way is surrender. So that is where you completely give in to your schema. So whatever your schema is telling you to do, you do. So for example, if you had the unrelenting standard schema, so that's when you always place really high standards on yourself or other people. So if you was to surrender into that schema, you would just continue to have these unrelenting standards to yourself or others. So surrender is simply just giving in to whatever that schema says, that is what you're going to do. And then you have the overcompensation. So this is when you do the complete opposite of what your schema is saying, it as a way to maybe potentially trying to protect yourself. So for example, if you had the self-sacrifice schema, so where you always put other people's needs in front of your own, if you was going to overcompensate and that was the maladaptive coping mode, you'd do the complete opposite. So you put yourself first and disregard everyone's needs or disregard what other people wanted from you. So that is when we look at the overcompensation. Then you have the avoidance. And this is simply where you try to avoid any sort of situation or event or person that could trigger your schema. So for example, if you had the mistrust or abuse, you may completely avoid relationships because then you won't have the opportunity to develop that relationship with someone. Or it could be that if we're thinking about unrelenting standards, you may avoid any sort of situation that is going to cause you to kind of have high standards or to achieve certain things. So it's about really avoiding anything that is going to trigger your schema. So that is the maladaptive coping modes. And then when we look at the other areas within schema therapy, we have the child modes and we have the adult modes. I'm going to do a separate video on that. So if you like this video, please give it a thumbs up. Please like and subscribe to my channel and watch this space because the next one is going to be schema therapy continued. I hope you found that helpful.